Well, hello everyone. Dr. Anthony Lordo here, your go-to dentist in Worthington, Ohio. I'd like to take a few minutes to talk about DIY dentistry, do-it-yourself dentistry. Well, I gotta tell you, working on your house and doing it yourself and putting new blinds up and painting the bedroom, well, that's a good thing. You know, you can save some money, you got a real sense of pride when you have something done. It's not like that with do-it-yourself dentistry. You might be wondering what I'm talking about. As you know, my daughter Lucia is around 14 years old and she watches videos and she said, "Hey Daddy, look at this lady. She's filing her teeth down with an emery board." Golly, I thought, why would someone do that? Well, I hear the new look nowadays is to have your teeth nice and flat across the front. Well, God didn't design us that way. Actually, when we're young, we have little bumps on the end of our teeth called mamelons, and that is a sign of youth and vitality. Golly, and now young folks are sanding them away, or even worse, sanding the teeth even further down and taking away that precious enamel we all have. Remember, enamel is the hardest structure in the body, and once it's gone for good. It's very difficult to put it back. Remember, if you sand your teeth down, it makes you look older now, but later on in life, when you're my age, you may want to look younger again, and then you'll actually have to pay a dentist to put those back on, those little bumps. Why? Because once you take them away, they don't grow back. The only way we can put them on is with veneers and crowns. Well, that's an added expense that you may not have to have if you just don't file your teeth down right now when you're young. Also, we see people doing their own orthodontics. Gosh, nowadays you can get on the internet and order your own set of invisible aligners. You don't even have to have a dentist help you do it. But I gotta tell you, you better think twice. Now you might be saving a few dollars now, but in the long run, if a dentist who isn't trained in bite problems or an orthodontist who isn't significantly trained to deal with tooth movements and how the teeth come together, you're gonna have yourself a big problem later on in life. The way God designed us, our jaw joints and our muscles and our teeth, well, they gotta work in perfect harmony. And just simply moving the front teeth around, kind of like the do-it-yourself clear aligners that are on the market right now, they really don't address the back teeth much. If you put the front teeth where you want them, but the back teeth aren't where they should be, you're almost destined to have jaw joint problems later on in life, that TMJ or TMJ disharmony or dysfunction. That's real hard to fix sometimes. So please don't do it-yourself orthodontics. That's one you should really leave to the professionals. Just this week we had a nice young person come on in into the office and she tried to do some do-it-yourself sleep apnea therapy. Oh my goodness, please do not do that. Why? Sleep apnea is a serious medical condition. If it is not properly handled, it is life-threatening. Remember, sleep apnea can lead to, oh golly, diabetes, weight gain, heart attacks, strokes, sudden death in your sleep. You really should never die in your sleep. That's usually sleep apnea taking you from us. Please do not do your own sleep apnea treatment at home. We work hand in hand with a wonderful institute, sleep study doctors, and we'll do a proper workup for you. And if you happen to have the type of sleep apnea that a dental device can help you sleep better at night, well, we'll get you in the right hands. Doing your own sleep apnea can not only be life-threatening, but it can also permanently destroy your jaw joint. Well, luckily, the young lady came in to see us before she did permanent damage to her jaw joint. So again, Dr. Lordo here, go-to dentist in Worthington, Ohio, saying please don't do your own DIY dentistry. We're here to help. Heck, we'll even do free consultations if you have a question. So remember, wash them hands, wear those masks, and most importantly, keep smiling.